Welcome to Health Matters, our membership and public engagement event. I am delighted to welcome you all today, and especially I'm delighted to introduce you to our Oxford Health Arts Partnership, which does wonderful work in our community hospitals and in our mental health wards. Our event is part of the Mental Health Awareness Week, where the theme this year is loneliness and how we can all tackle that. And I can testify that Angela Conlan and Tom Cox with their activities are doing just that in our hospitals. I am also proud to be supporting the Age of Creativity Festival, which is organised in Oxfordshire by the Age UK Oxfordshire. And there will be some more information about that on our Q&A panel. You will be able to ask questions from Angela and Tom by clicking on the little speech bubble with a question mark that will open your Q&A panel. So please post your comments and questions to ask us, and we will answer as many as we can in this event. And without further ado, I'm going to pass you on to Angela and Tom, who will be introducing themselves. So on to you, Angela.
Good afternoon, everybody. I'm Angela Conlan. I'm the Arts Coordinator for Oxford Health Arts Partnership, and welcome to our event today.
Thanks, Angela. I'm Tom Cox. I'm the Artscape Project Manager, and I've been with the Trust for, well, since about 2011, 2012. And when I started, it was just myself and it was branded as Artscape. So we're talking today about the Oxford Health Arts Partnership and how we've moved from just being Artscape to introducing Angela and creating with care. So it was originally split that Artscape worked with mental health and creating with care was working with the community hospitals, but we're trying to rebrand and sort of form a partnership. So we're going to explain a bit about that and give you some of the history of the projects that we're working on and some case studies as well. Anything to add to that, Angela?
Yeah, so I was just going to say that Creating with Care is relatively new. We started in 2017, and before the project, the community hospitals didn't really have much in terms of creative activity happening. And due to the success of the project, we very quickly rolled out to 6 of our community hospitals in 2019, but joining up with Artscape to form Oxford Health Arts Partnership just really strengthens the vision that we had initially for the arts in our community hospitals, and you know, it just strengthens what we're going to do. Next slide, please.
Great. So Angela and myself have been working on a new strategy which will cover from this year to 2026, and part of that has been trying to put together our vision, which you can see on the screen now: inspiring recovery, well-being and growth through creativity. We use a very broad definition of art that includes the environment and activities that promote health and well-being. So it's much more than just painting and drawing or dance and movement, as Angela does. We try to engage all the senses that we have, and that could include something like walking, the environment. So I do a lot of work around the gardens and green spaces in the hospital, and that's supported through the Trust. And I would say that we're very much about making and taking part in activities and seeing that as much as important as finished products. So, you know, if you're enjoying making and taking part, then that's going to increase your health and well-being. So it's very much process and outcome driven. Would you agree with that, Angela?
Absolutely, yes. Next slide, please, Katerina. So we're going to just show you a film that Tom and I made last year, and this kind of gives you a bit of an overview of what we're trying to achieve and what we have been working on. So when I come into hospitals, I am working with patients and staff to increase well-being through arts projects. We might one day be doing some dancing, we might be doing some mosaicing, we might be doing some painting, but the idea behind it is to be mindful, to increase relaxation, and just to take people's mind off of where they are just for a moment.
The aims of the arts in the hospital is to enhance environments, to enable patients to be creative. We can get patients to make a piece of art which we can then put on the wall. That's even better because it gives them ownership of the work that they are doing and the environments that they are going to be living in.
Our community hospitals have about 70% of the patients have some kind of cognitive impairment, so we want to be really inclusive in everything that we do. We often find that stories come out that from people's past, and they can start reminiscing and start remembering who they were. I was working with one lady who was quite depressed, and during the session she turned around to me and said, "Thank you, I now feel young again, and that is why I do this job."
What I try to do is take the patient on a journey with me, and I allow their creativity to flourish. And it's really nice when you get a patient that'll say to you, "I wasn't sure what we were doing, but I really get it now. I can see what we were trying to achieve." And they feel really good. And when they create a piece of work together and then they see that on the wall, that's something that they can be really proud of.
The Oxford Health Charity has been supporting a number of different art programmes across the Trust, and it's just been brilliant to see them develop. In our community hospitals, we've had some brilliant dancing and artwork and creative work that's really made a difference for patients to be able to see their artwork coming up on the walls of the community hospitals that they are actually in. In our mental health wards, we've had different projects coming in where the patients have been able to really engage with art to help them with their recovery journey. So they've been able to create things like mosaics and murals, which are then there for them to see and see how far they've come in their journeys.
I love working with staff and think it's really important within the hospital environment to look at staff wellbeing, and running dance sessions and also mosaicing have been found to really reduce stress.
Oh, it's really great to see everybody engaging and taking part. Angela does great work. Just encouraging the staff to get out and take 5 minutes break.
You come out of a really busy unit, and to come out and have the opportunity to do a little bit of relaxation, a bit of meditation, it really does help with mindfulness. It makes you come alive, I don't know, feel fresh, revitalised.
It's been really useful and energising to come out and do some stretches with our colleagues. It's a time to sort of clear the mind when we've got potentially a stressful day ahead.
Yeah, I'm ready for the day now.
By providing lovely garden areas like this, it encourages staff to come out and spend a bit of time. It provides spaces for patients to exercise and walk around.
The power of art in this environment, I think, is similar to the power of nature, really, in that it can lift the spirit. It's a really lovely thing that some of us don't have much spirituality in our lives. So actually, when you see a good bit of art, especially in public, like when it kind of catches you unawares, you're lifted by it, which is just a really positive thing, especially with healing in a hospital environment. It's it can be really powerful.
The Oxford Health Arts Partnership is an exciting new venture, taking the arts to a new level within the Trust, working with Angela on a variety of projects, which will be visual, which will be dance, which will be music. It's just a great time for the patients and for the staff.
So it's great that we're now working together, Tom and I, because we can be stronger together and really focus on bringing the arts to more people within the Trust.
Oxford Health Charity is really happy to be part of the newly formed Oxford Health Arts Partnership.
The future is really exciting for the arts within Oxford Health. We're really looking forward to working together. We're really looking forward to developing more opportunities for our patients and staff to take part in cultural activities and to enhance the space that we work in.
That's great. I hope you enjoyed that little film. It brings up an important third part of the partnership, which is the Oxford Health Charity, which we didn't mention at the start, but we've moved to work much closer with the charity who fund a lot of our projects. So we're very grateful to be now part of their team and working with them really closely. One thing that we get asked all the time is why do we use arts in healthcare? What are the benefits? And there's a lot of evidence out there. There has been a growing body of evidence over the years, and you can see all the reasons why we might want to use art. And before the pandemic, there was some great publications put together, and I would encourage you to look at the All Parliamentary Group Arts and Health and Wellbeing paper that was published in July 2017. It really gives a good background to the arts and health and why it's used, and gives some of the key indicators. What we've found is that since the pandemic, a lot of this evidence is now sort of slightly out of date, because we've actually been forced to use new models and new ways of working, including, like we're doing today, working online and offering things for patients over the internet, which has been really challenging and difficult, but has also broadened what we do and given us a larger reach across the trust. And personally, I would say that the pandemic has really helped to show why well-being and arts can really improve people's lives. People were taken during the pandemic to a point where they were, writing poetry, doing some sewing, all these sort of activities that were usually sort of put to one side or in addition. They were using these to enrich their lives and express themselves. So through the pandemic, it's really shown how strong an arts program can be and what the benefits can be for both staff and patients. Angela, you were going to comment as well.
Yeah. I was just going to comment on the WHO report, that the World Health Organization report, which we've put a link to on the bottom of this slide, which sets out the evidence base for arts, health and wellbeing. This report came out in 2019, and a lot of it could be considered alongside person-centred care within the hospital setting. For example, the review highlights the large evidence base for the theory of person-centred sessions in art forms such as pottery, dance and reading that can increase self-esteem and decrease behavioural and psychological symptoms of dementia, whereas music and dance can help increase social interaction and reduce isolation. And also that participation in the arts has been found to reduce stress and regulate emotions. Next slide, please.
And in studies, older people have sort of indicated that arts and taking part in workshops is one of the best drivers for them against loneliness and to help stimulate their minds. So as the population gets older, it's really important to carry on these activities and make them accessible to as many people as possible. You can see some of the indicators on the screen here of what the arts can help to achieve. So yeah, all sort of links are there for the King's Fund. And what we're going to move to now is just to show you some case studies of the work that we actually do across the trust. So Angela's going to start with the residency programme, and then I'm going to show some of the stuff that we do with mental health. So over to you, Angela.
Thank you. So our Artist in Residence project, which was funded by the NHS Charities Together Fund and Oxford Health Charity, took place over the last year during the COVID pandemic. The effects of the pandemic meant that patients were more isolated in their wards, with limitations on the way that people could interact with each other. Artists and staff had to wear PPE and observe social distancing, and ward staff were exhausted during the incredibly stressful time. This could have meant that the project was hampered, and in a few ways it was directly affected by the pandemic conditions. For example, artists had to be ready to shift sessions to a different ward or online at the last minute. And for me, longer risk assessments and a longer sign-off process for them. However, rather than causing additional stress, the project definitely raised the spirits and outlook of ward staff, clinicians and patients alike. It brought respite, connection, enjoyment and improved well-being to everybody despite the pandemic. The project was externally evaluated by Helena Brock, and it's available, the full report's available on the Oxford Health Charity website. This slide shows some of the benefits that we found for patients during the project that Helen found. Over the first 6 months of the project, we had 236 sessions for 1,225 patients and 382 members of staff took part. I just thought I'd read you out a couple of comments from people that were involved in the project. So this first comment is from one of our artists. One of the patients was adamant she wasn't creative and couldn't do any art. She was, however, knitting, so I asked her if she could design a sweater. Initially, she maintained that she couldn't, but then after I'd given her a pencil, some coloured pens and paper, she came up with her own design for a tank top. She was completely over the moon with her achievement, telling me, "I've never done anything like this. I didn't think I could. It's taken till my 90s to be creative, and it's the first time I've been praised for being creative. I'm very proud of myself." This is a patient comment about dancing on the ward. "It brightens my day, otherwise I'd just be sitting here watching TV. I want to go home now and continue my recovery with music and dance." Finally, I've got a staff comment. "You can see how they forget their pain. They are taking fewer painkillers, and that's good. They're feeling less pain because they're less anxious and more engaged." Next slide, please. So for our staff, they did take part in the project. We had some specific staff sessions as part of it. Some of them in meditation and dance, some in visual arts. Artists also prepared craft packs for staff to take home, which were really well received. However, the biggest benefit to staff was seeing their patients happy. I have a couple of comments here from staff. "We see happier patients. This makes our job easier because they're in a happier place, a happier frame of mind. It's promoting their independence and it helps them get better quicker with a sense of independence to go home." Another comment, the project, improves our working life. A happy patient who feels worth something and part of a group, they will work harder for therapists. The patients are...
Sorry, Angela, you've gone muted by accident.
Oh, I don't know how I did that. So a final comment, artists and volunteers supporting them add extra person power to the ward. It releases us to catch up on some of the things we need to give attention to, knowing the patients are looked after and engaged. Next slide, please. So there were also benefits to artists as well. Each of our artists brought something different art forms, different approaches, different materials and experience. It was fantastic to see the ward staff welcoming them as a new member of the team. And there was a palpable sense of welcome and anticipation when the artists were on the ward. All of the artists were curious, generous and committed to the spirit of the project. For all the artists, there were some areas of growth and development in their own practice, as we've highlighted here. They recognise that this is important work that was meaningful for both themselves as practitioners and the patients they were working with. Next slide, please. And finally, the recommendations for this project was that it should be rolled out. There's potential for a wider range of settings, not only within the community hospitals, but for other areas of the trust. There's potential also for mentoring and involving a younger generation of emerging artists, and also creating a programme of training for artists and ward staff together, so that there's a shared understanding of how the arts can help patients and staff alike. Something that I'm looking into now is considering a model of social prescribing. So a lot of our patients, like the lady who was knitting, discovered that they can be creative into their 90s and find a new activity that they love doing and want to continue it when they leave hospital. So I'm looking at a kind of method of how can we social prescribe the arts from hospital to home. Next slide, please. You're mute, Tom.
Thank you, Angela. Sorry about that. Thanks. Yeah, I'm just going to talk about a few case studies that we do with patients and staff on the mental health side. So Artscape works with the Recovery College. There's a Recovery College for Oxfordshire and Buckinghamshire, but I predominantly work with the Buckinghamshire Recovery College. It's a really great model for people to get involved with, and it's open to patients, staff and carers. Basically anybody can sign up and take part in courses across the Recovery College, and they do really interesting courses ranging from arts through to depression, how to cope with anxiety, all sorts of different things. But I run arts courses for them, and we typically do a 6-week course every term. And here's just some of the examples of the work that people made in the last session, which was based on colour. It's really interesting stuff. So the picture on the left hand side of the hexagons, this was a Greek lady who'd was about 80 and had never made any art before, and she was really kind of, I can't do this. And gradually over 6 weeks we were able to encourage her through the group work and get her to sort of engage and start making some drawings, and she was really wonderful. It was great to see, and that's the kind of journey that we see with the people who take part. Generally they come, they're very nervous, but it's as much about joining a group, socializing, getting them engaged, and then taking them on a really lovely journey where they get to experience making art for the first time, some of them, or try new skills. There was one lady who every week came in and said, oh, I'm rubbish, can't do anything, don't like doing this, why are you making me do this? But then would send reams and reams of drawings and stuff that she obviously was getting a lot out of it, but you have to sort of engage with them and make sure that they understand what they're doing, why they're doing, and why it's beneficial for them. So it used to be that we would do all this stuff face to face, but with the pandemic, we've had the challenge of actually delivering all this stuff online. And that's been a real eye opener and has opened up different ways of working. So traditionally we would sort of work in groups, get people into the hospital to sit down together for maybe a couple of hours and actually do the drawings and do the artwork together. But now it's more of a teaching model where we'll set homework and then we'll come back and discuss what we've done. And it's a really different way of working, but it's really kind of rich and rewarding. One of the great things about the courses that we run is that they're all co-produced. So typically it's a person who's an expert, so that might be myself or one of the other sort of trained people, and then there's somebody with lived experience that also develops the course. And we've also built in a volunteering aspect of it as well, so there might be 2 or 3 people helping to develop the courses, and then they deliver them together. So we've tried to take on this sort of co-production and build it into a lot of our work, because it's a model that works really well. Do you want to go on to the next slide there, Katrina, for us? So we do a lot of work with the adolescent units across the trust, which we've got many. So we've got the Highfield, we've also got Marlborough House down in Swindon, and there's the community CAM services as well. We're creating a new PICU at the moment, an adolescent psychiatric unit, intensive care unit, and you can see some of the work that they've started to create and think about for this. We do sort of mosaics most years and get them to engage and make these wonderful activities, but we want them to co-produce the work that goes into the PICU. So we're running consultations, asking them about colours, and even the simplest designs, like this sort of drawing that a girl made. She was really sort of ill, but we managed to make this lovely sort of shape of an octopus. We were able to then work up into this great design, which will become wall adhesives and stuff like that. So working with the young people to make sure that they can have some of the artwork and make it more homely for them. Next slide there, Katrina. So we did a whole load of workshops last year for staff, and this is something that we've been able to do online, and it's been really great to engage with the staff. And this was a project that we did with a couple of local artists to reflect on what the experience of the pandemic and COVID was like. And over sort of 3 weeks of workshops, they were able to create all these different textures and papers, which the artist then took and turned into these sort of bespoke works of art. It's been really interesting seeing what people thought and how they felt about it, and it's just created a space for them to reflect, a sort of safe space for them to think about their sort of response to the COVID and how art, they've sort of seen how art can help open that space up and allow discussion to happen. The charity now has been able to pay for some of these artworks to be put around the hospitals into different waiting areas. So it's nice, we've actually used the staff to create artwork, which is then enhancing the walls. So it's a really nice rounded journey. Next slide there, please, Katrina. And this is a project that we've just completed over in High Wycombe. We've had a new building which we've moved lots of services into one central building in Wycombe, and it looked a little bit tired outside. So we've worked with a local CIC who work with lots of volunteers and are great on conservation to just improve the area. Really, we've put artwork in. We've worked with young people to create these artwork. You can see Dan, the artist, there. We've planted trees and put planters in and created a new seating area. So it's great that the building has been improved and has been tidied up, but it's also great that we've used volunteers. Staff were encouraged to get involved. Because we use the CIC, they're using volunteers and giving opportunities to people who typically wouldn't be able to work in a normal job, but are able to take part in this. So it's really great that we're trying to encourage this model of working, which is not just giving contractors access to the spaces. We're actually engaging the wider community and getting as much volunteering in as we can. So that's just a little flavour of what we are trying to do across the trust. Next slide.
So this is just one of the ways that we know it works. We have been collecting evidence since January using this form, and just with the artists asking patients how they feel before and after a session. We've noticed that there's a 48% increase in how people feel, which I think is quite a good testament to say it does work. Next slide, please.
So this just shows we couldn't do any of the work that we do without partnerships. And we over the years, we've had really strong partnerships with arts organisations and other organisations across Oxford, and further afield. You know, when we're working in Bucks, we work with the Arts Centre there. So this is certainly not an exhaustive list, and I know there's a couple that you want to mention as well, isn't there, Angela?
Yes, it's not an exhaustive list at all, but I did want to mention the Orchestra of St John's, who we're currently doing some work with in having musicians on the ward, back on the ward again. Next slide, please. So this is our strategic plan for the next 5 years in one slide. So it's quite detailed there. I just thought I'd go into detail about how we're going to grow, particularly the Artist in Residence programme that I spoke about. So we're currently fundraising so that we can continue the project because it's just come to an end, and we can have regular arts provision on all of our community hospital wards for a longer period of time. We want to expand our volunteer team, and in year 2 we want to try and get a training programme together for early career artists. We're working towards developing an integrated programme for our community hospitals and mental health wards, and joining what Tom and I both do. Over to you, Tom.
So finally, we just wanted to mention another strand, which is the research part. We know that it's really important to capture the evidence of what we do, to show what the benefits are, and we're really excited that the trust is really behind this and wanting to see this as a growing aspect of our work over the next few years. So we're going to be working with Joe Smart, who's lead for the organisational development of Oxford Health, and just look at ways that we can measure what we do across the trust. So that will hopefully, by 2026, that will be embedded within all the projects that we do, so we can show the real benefit for arts and health, and make the case to continue to grow into the coming years. So I think that's a nice place to leave it, really.
Yeah.
Okay, thank you, Angela and Tom. I always think that I know quite a lot about what you do, but I learned so much again. So we have quite a few questions here. I think I'm going to pass the first one to you, Angela, and this is from our audience. Somebody's asking, can visitors like family and friends take part in the activities?
Yeah, now we're allowed visitors back on the wards, or if there's an artist on the ward while a visitor's there and they want to be involved, they are absolutely welcome to join in with any of the artist sessions. At the moment, most of our artist sessions are taking place at the bedside, so it would be a private session between whoever they're visiting and the relative, but sometimes we run things in the day rooms or in the gardens in more of a group experience where everybody is welcome.
Thank you, Angela. And I think this next one is also for you. How can local artists take part in this programme if they want to do so?
So when we're expanding the team, we advertise on Oxon Arts, which is a really great platform for opportunities for artists across Oxfordshire. And also a really good way to get into it, because a lot of the time we're looking for artists who've already got experience of either working with older people or in a hospital setting or in a mental health setting, is to come and volunteer with us. So that's a really good kind of stepping stone to see what we do, to see whether you actually like working in a hospital setting, because it is different to other places.
Thank you, Angela. That's very useful to know. And just for the sake of fairness, I'm going to pass the next one to Tom. And could you tell us a little bit more about what kind of work patients particularly enjoy?
Well, the music is always a real winner with patients. They love getting involved with the music. There's something about music which is really sort of integral to us as human beings, I think. So having music on the wards can really have a wide effect it's not just the person listening to it, it's afterwards you'll find that the whole ward will calm down. And because of that, the staff really enjoy them, musicians coming. But also you can see that it has an effect on the patients. They'll engage, they'll start to talk. People who have been really acutely unwell, it might be the only time that they actually engage. You'll see the sort of spark behind their eyes. I'm sure you'd agree with that, wouldn't you, Angela? You sort of see a big response.
Yeah, absolutely.
But I think,
and I can agree with that, because I've been in some of your concerts, even at the time when they were only outdoors, and people were sitting and listening through the window. So I can really see that. And
but I would also say that when people take part in the workshops, like I say, some people find it really difficult and think that they're not very good, but it's really nice to see over time as they engage and take part. And if you repeat some of the tasks, and you can see the confidence growing in them. So it's something that you have to practice. There's a reason why they call it, you know, you're a practicing artist. And it's because you have to do it more than once, you know. So I really bang on about repeating things and trying things again and again, so that you can't just do something once and expect to be good at it. And that's what we hopefully allow people time and access to do, to really engage with it, and they will feel what the benefit is by having a go and seeing the results.
That's really lovely. And carrying on from that, Tom, are patients encouraged to carry on with the activities on their own, for instance, after this discharge from the hospital?
Yeah, so with our partners, we can point them into directions of where they can take part. You know, the recovery college is a good way for them to carry on being engaged. And it depends how well they get. You know, people are very welcome to come back and volunteer and take part, but there are lots of organizations out there, like I say, with our partners, they could go and join a mind group or whatever level that they want to sort of engage with. We can point them in the right direction.
Okay, and maybe I'll pass the next one to Angela, just to keep this fair. We have a question of who are you partnering with, but I think your presentation already answered that one. But there's another one from our audience, which is: my son has been admitted 2 times, was in response housing and now in mind housing. In all these situations, no creativity was ever provided. I would bring something to do for my son and other inmates. That's the term used here. Giving drugs is all I see happening. So why not are you in these places?
Oh, I think that's better for Tom to answer that one.
Okay, I do apologize.
I think, you know, you're looking at the team here. It's me and Angela, so we are spread very thin over quite a wide geographic area, and we do try to be equitable across all the different sort of departments of the trust. I know that there has been weekly music sessions in some of the response centres. So the Orchestra of St John have been going in week after week and offering concerts, which you know, have had a good attendance, so that they happen weekly. And we've done other outdoor concerts during the summer when the weather's good down there. And Artscape did run some art sessions at Response last year in some of the Response housing. So we do it, but it's generally on a sort of short-term project basis, because if we were just there doing it every week, then you know, there just wouldn't be enough hours in the day. So I know that's not a great answer, but we have done some services down there. So I think just need to demand more, and they'll contact us to put some more sessions on.
Thank you, Tom. And as we saw earlier in your strategy, growth is one of your targets, to grow the program. So I guess this falls into that category. Maybe you can answer the next one as well, which is about, do you do anything for carers?
Yeah, we do. So again, the Recovery College is open to carers to take part. And last year we ran a carers workshop as part of, I think it's part of Carers Week, and that's coming up in June again. So I'm doing another workshop specifically for carers to take part in. And what I did find last year, that one of the people who came to the carer workshop then joined one of the Recovery College sessions. So they did a sort of 2-hour taster session and then came and did a 6-week session. So that is there, open for people to take part.
Thank you, Tom. And I would just urge everybody to follow our website, because we will advertise this carers event week and sessions as well. So keep an eye open for that. There is also from Paul Wells, who I know works for the Recovery College. Not a question, but a comment. Tom, thank you so much for all the fantastic work which you do with Bucks Recovery College, and for all your help and support. As you have alluded to, the courses have needed to be adapted now that courses are online. Thank you once again for all your continued support and work which you do with the college.
That's very kind.
So that's nice feedback for you. And somebody called Marie is asking, do patients ever lead art sessions?
I can answer this.
Okay.
Yes, they do. Most of all the artists that we work with are very experienced in leading and facilitating sessions. So what we all do is give people the opportunity to lead within a session. So for myself as a dance artist, there will be opportunities for patients to choreograph, or maybe run part of the session if that's something that they would want to do. But we also try and facilitate that as part of the session. I don't know if, Tom, you've got anything to add to that?
Yeah, well, again, it's very much part of the co-production, you know, so either they might co-produce the session that we're running, but certainly built into a lot of the sessions is the opportunity for them to lead and take part. I'll often go into a session with a very minimal amount of information and then be led by what the sort of participants want to do, and try and be responsive to them. So it's not us giving them the stuff, it's taken from them and developing on what their ideas are as much as possible.
Thank you, Tom. And this brings us to the end of the questions. There is only one comment left here, which is saying, thanks for an inspiring presentation. So with that, I think we are about to close the event. Thank you everybody for joining us today. This event will be posted online as well on our YouTube channel. So if you know somebody who wanted to see it but was unable to attend, please let them know. And this will be also publicized on our websites. So thank you for watching. And again, I would also encourage you to join our trust as a member. And so you will stay informed of all our membership events and other events, and also of all the work that Oxford Health Arts Partnership does. Thank you very much and have a good afternoon.
Thank you.
Thank you.